we turn now to a health issue many Americans can relate to nearly 2 years into the pandemic. COVID restrictions have kept many people indoors, making it difficult to lead an active, healthy lifestyle. And that is creating problems for doctors that extend far beyond the virus. This morning, as part of our American Heart Month coverage, Dr. Narula introduces us to a man who's turning his life around after a scary, life-threatening diagnosis, a pulmonary embolism.
With every step, Benjamin Henderson is on a path to a healthier life.
I can't push myself yet, but my exercise is walking. I do a lot of walking right here in the park.
The 56-year-old Henderson is lucky to be moving at all. A little more than 2 months ago, he almost lost his life.
I got dressed to go to the store, and as soon as the elevator came up, I got on. As soon as the door closed, I went into a pant.
He got himself back upstairs and called his cousin.
My cousin, he helped me to the bed. When I woke up again, it was 1:30 in the morning. My stomach and my chest was tight, felt like a knot. So I came out and I told my cousin, I said, we have to go to the hospital.
So you started having symptoms around 3 o'clock in the afternoon?
3 o'clock in the afternoon, 3 p.m., yes, ma'am.
When did you call EMS?
Called EMS about 1:30 in the morning. Yes,
so you waited 11 hours?
11 hours, yes, ma'am.
What did that do to his chances of survival by not seeking care immediately?
He was lucky.
Omar Latouf is Henderson's cardiovascular surgeon. Within 30 minutes of meeting his patient, he was ready to operate.
I think if he had waited any longer, he would have died. I think he could have gone to sleep and never woken up.
Henderson had a pulmonary embolism, a dangerous blood clot that often starts in the leg and travels through the heart to the lungs. A large clot blocks blood flow, causing the right side of the heart to fail as it tries to pump against the massive blockage. In certain cases, this can lead to cardiac arrest and possibly death. Smaller emboli can be treated with medication, but in this case, Dr. Latouf knew he had to operate. And when you opened up his pulmonary arteries and saw the extent of the clot, was it larger than you had anticipated? How does it compare relative to...
It was quite large. It was almost 16 inches long by the time we pulled the whole thing out.
When you see a clot that's that big, what is the potential for survival for a patient who does not have treatment?
Not very good.
Latouf says several factors put Henderson at risk, including obesity and a sedentary lifestyle. Henderson had spent the better part of 4 years caring for his mother, who suffered from dementia. He says during that time, he ignored his own health.
Dr. Latouf told me that because of lack of exercise, because of my diet, because of the obesity, and that's where the blood clots came from.
It sounds like you're a bit of a miracle.
I feel that way.
Since being released from the hospital in mid-December, Henderson has lost more than 40 pounds, and Dr. Latouf says he's encouraged by the progress. What do you think it was that saved you?
I'm spiritual, and my mother just passed away 7 months ago, and I took care of her. I took care of her for almost 4 years, 5 years, and I was a caregiver and everything. And I do believe that she was holding my hand the whole way. You know, I have a 10-inch scar in my chest. That's a total reminder that I have to take care of myself. I have a second chance at life.
Dr. Narula joins us right now. So what are some of the risk factors for pulmonary embolism?
Well, I'm so glad you asked, because this is actually the third leading cause of cardiovascular death after heart attack and stroke, which we don't often talk about. And it can happen to anyone at any stage. So risk factors include things like bed rest or long plane flights or car rides more than 4 hours, obesity, smoking, certain hormone therapy like oral contraceptives, hormone replacement therapy, pregnancy, cancer or cancer treatments, and major hospitalization, like major prolonged hospitalizations or major surgeries. Any of those things can increase your risk. And then finally, genetic conditions. So some people have a family history of clotting. It's really important to know that, because you may have a predisposition to clotting disorders.
It's very scary.
What about symptoms if you're worried?
Right, so also important, because left untreated, there's a 30% mortality with pulmonary embolism. So with pulmonary embolism, we're talking about shortness of breath, chest pain that we say is pleuritic, meaning it's worse when you take a deep breath in. Some people feel a rapid heart rate and may cough up some blood-tinged or pink sputum. And then as far as clots in the legs, we're talking about red, swollen, tender, painful legs, usually one leg. So recognizing symptoms is really critical.
And don't ignore the symptoms.
No, please. These are very important to get checked out immediately.
Dr. Narula, you're the best. Thank you so much.